Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst. And I have Faraday with me again, and I'm going to let her introduce herself, and then we'll get started, and we're going to talk all about P-shots today.
Hi, guys. My name is Faraday Golombieski. I'm the nurse practitioner at Revitalize MD, and we're here to talk about the P-shot.
The nurse practitioner extraordinaire at Revitalize MD. And yes, we're going to talk all about P-shots today. So what is a P-shot? If you haven't heard about it, then now is the time to hear more about the P-shot, the performance shot.
Ooh, I like that. The performance shot. We might have to quote that somewhere on the website, right?
Yes, yeah.
So when you hear about the P-shot, most guys go, ooh, that sounds terrible, right? But it's the guys that have had it done, they say it's not painful. It's not what they expected. You come in, it's very simple. It's a quick procedure. We draw your blood, we spin it down. We take the platelet-rich plasma from your blood, and we use that and we re-inject into the penis. We do a local numb, so you do not feel anything. And that's always the biggest thing. The guys are like, yeah, okay, it'll help, but does it hurt? Right? That's always the question. I don't know about you, Dr. Durst, but that's what I get from everyone. Does it hurt?
So absolutely want to know that. But I laughed because at first, and I don't talk a lot about what I do specifically if I'm at a social engagement, but a lot of times people that I'm with do talk a lot about that. And so then I'll be in a group and somebody will ask what I do. So we start talking about, P-shots or GAINSWave or sexual wellness. Even if you say sexual wellness, they're curious of what that means. So when you get to the P-shot part of it, there's two comments that every single guy makes, right? The first one is, oh, I don't need that. Across the board.
Course. No one
the
needs
first
it,
one.
Right?
And the second one is, I'll never get a shot in my dick. Like that's the second, or I'll never get a shot down there. Nobody's touching me with a needle there. So those are the first two comments across the board. Conversation goes on, and then I can almost time it 10 minutes, 15 minutes, and they're back over. So what is that again you do?
How does that work?
So how does that work?
Where are you putting
What is
it?
that? So yeah, they're very curious after, but they definitely, pain is the first thing a man thinks of when they think about a shot or a needle going into their penis. And no man wants to even think about that. But again, we've been doing this for years. We train other providers to do it. And so we know how to do it where it's pain-free.
Exactly. And you're numb. You're numb. You're not going to feel it.
We numb multiple different, like not only are we doing a local before we do a block, but then we do a block. So essentially, then it goes from, okay, it didn't hurt. Now is my penis going to be numb for the next 6 months? And it's not, because that's the next thing is like, am I ever going to feel it again? And you will. You'll feel it again. It goes away in, a good couple hours. And so, but you didn't feel anything with the P-shot, and that's the important part, right?
Exactly. And then you get the results, right? So it helps improve erection strength. It helps improve sensitivity. So you get those benefits as well from the P-shot, especially then when you pair it with other modalities, it improves.
Enhances all those results. So, and we do, we're drawing blood, spinning it down and getting the PRP, which is platelet-rich plasma, like Faraday was saying, and platelets have growth factors. We re-inject them into a tissue to communicate with stem cells in that area, and it's going to regrow tissue that is normally in the penis when we're re-injecting it into the penis. So think about, what do we have in the penis? Well, we have sensation, right? That's what orgasms are about. So you have nerves, so you're regrowing nerves and regenerating, unhealthy nerves into healthier nerves. And then what do we have? It's a marvel of biology, of science. It increases blood flow by 40 to 50 times in a matter of seconds. Where else can that happen and you not have a serious issue like brain aneurysm or rupture? Nowhere else does that happen where it's supposed to happen. And then so you get blood flow in, it stays in, you get an erection. So again, we're regenerating healthier blood vessels, blood vessel walls, increased blood flow into the penis.
And then keeping it there.
Because
that's what's important, right?
Yes.
You want to get it up, but you want to keep it up.
That's right. That's the key. So we're locally working with the P-shot. So we are injecting into multiple different areas in the penis. And again, you're numb, you don't feel it. And that's going to increase sensitivity and blood flow. So you get an erection, you get better orgasms, all those benefits. But it is local too. the penis. And so again, if there's more functional changes, sometimes we're talking about other treatment modalities that we pair with the P-shot that help us get at those other issues. So if it's a blood flow issue, you have high blood pressure, high cholesterol, diabetes, then you may have larger vessel issues. And that's when we'll pair it with something such as Gainswave that reaches those big blood vessels and not just the blood vessels in the penis. But even if we're talking about just performance for men, we have a lot of men that will come in for a P-shot just for optimal performance. Yeah, just to be better in the bedroom. They want to last longer. They want to have decreased recovery time from from sex to sex, so they don't want to wait longer. They want to have better and stronger orgasms. So it doesn't have to be that you decrease function to actually seek out these procedures and these solutions. So
we've also had guys come into the office who have had trauma into the area, so they have built up scar tissue. So the P-shot works great for that as well. So we see multiple different reasons why we're doing the P-shot, and the P-shot's one of those shots that just keeps giving, right? So you get the shot and we're building those, right? We're putting those growth factors in. So that takes time. So guys, the other question we get is it immediate? Am I going to get this P-shot and am I going to get better erections tomorrow? Am I going to have more sensitivity tomorrow? Well, the sensitivity might improve a little bit quicker. We do hear that, but we need to build that collagen elastin. We need to let those growth factors talk with those stem cells and regenerate. So it does take time. So you're looking at 2 to 3 months of peak optimization from that shot, and then that can last as long as 1-2 years. So definitely, like I said, it's the shot that keeps giving.
Shot that keeps giving. I like that. That would be an add-on to the website for sure. So I love that. And it's true. It does take a little bit longer. It's not like a medication. So if somebody has pain and we give them a pain medicine, their pain goes right away. But that's a medication. What we're doing is helping your body regenerate, giving your body back what it needs to regenerate. And so that takes time. Cells don't develop in a matter of hours or days. It takes a while. It's a very intricate system. And the body's amazing. It can repair itself if we give it back what it needs to repair itself.
To repair.
Yeah. And that's what happens if you think about, so even the P-shot and how it was developed is Dr. Runnels is the one that developed that. And again, just looking at orthopedic studies, and at some point we'll have him on the podcast and let him talk himself about, what led him to the P-shot. But again, just reading orthopedic studies and PRP and how it regrows, cartilage and blood flow to a joint and to, orthopedic injuries or soft tissue, locations, that why wouldn't this work in the penis? And so, and lo and behold, it does.
Regenerative.
Yeah. It does. And so again, not only going to a provider that you trust, so you need to find an office that you trust, somebody that is, again, very experienced at doing what they do. We use the best kits. We have the best procedures, the best technique and how to place them and to make that a painless procedure as well. But we don't know how your body's going to respond. So the thing you want to take out of it is that question of the expertise. So are we using the right kits? Am I going to the right provider? So you want to go to somebody that's an O-shot, P-shot provider. They're on a network again. Even if we're talking about pairing it with other stuff, Gainswave providers, people that have actually spent the time and money to get the expertise they need to get you the solutions that you want. And so making sure that you're going to somebody that is trained to do these procedures. And in fact, we train other people and other providers, not other people. We don't treat any DYIs.
we don't treat randoms.
Yeah, or DYIs, none of that. But anyhow, we train other providers to do it because we want to get these services to more people. And we have a lot of people that travel in now because they're not provided in a local area that they live. And so again, those are definitely options, and finding a solution in an office that you trust and you feel comfortable with and you're not hesitant to talk about whatever issue might be bothering you.
Exactly. I think that's key, is finding an office that fits you, finding people that you are comfortable talking about, because it's intimate stuff, right? We're talking about your erections, your erection strength, your orgasm strength. Are you having orgasms? Are you able to orgasm? Are you able to penetrate? Are you able to complete sex and be satisfied with your performance and that completion? So we're having these conversations that need to exist to know where you're at. And like Dr. Durr said, sometimes performance isn't an issue. You're just trying to optimize, right? Who doesn't want better sex, more sensitivity, improved erections, right? So there is options for that as well.
I don't think I've ever met a man that has, said no to better performance in the bedroom. I don't think that I have ever heard that one say. I've never had that said at one of the social, engagements I've been to. I've heard the other two things: no shots and I don't need it, but never, right, I don't need better performance. I didn't actually hear that statement. So, and I would argue, and you can leave a comment if maybe that's something that I would love to hear it said for the first time. And, but I don't think I will hear that. And so again, I think that better performance and optimal performance and just being a beast in the bedroom will never go out of style. It'll always be something that you want. And so again, I think that you brought up a key point though, before we close, is Peyronie's disease. Oh, yeah. And, that's a huge thing because again, you can have sometimes, you've heard of fractures, and that's a little more, fractures of the penis is a little more severe, but sometimes you might have some minor trauma or even a Foley placed with a routine surgery. And then after you get some scarring and curvature. And again, that progresses to erectile changes and dysfunction over time. And so getting on that sooner rather than later, sometimes it can be a little painful. Sometimes it can be painful at rest. Sometimes it's painful with erections. That pain and the changes that take place with that are definitely progressive over time. And there's not many ways to treat it. There is Xiaflex you can inject, and that's not known to necessarily work, can be painful and quite pricey. Again, an approved maybe treatment, but do you have complications with it? Does it always work? And the answer is yes, you have complications, and no, it doesn't always work. You can have surgery if you want a shorter penis. And so
maybe it work, maybe it not work, maybe not be able to get erections afterwards. There's some serious side effects to surgery. And that's a big jump right there versus a P-shot. A
P-shot. And I would argue that anytime you cut or you have a medication, you potentially, and definitely every time you cut, you're going to affect function. But every time you take a medication, you potentially have side effects. These are regenerative procedures that we're doing what's natural to your body, giving your body back the communication tools it needs to repair itself. So there's no way you can go wrong with that. And again, you just get better erections, better orgasms, stronger orgasms, and again, more consistent erections because that affects confidence and the bedroom.
So like Dr. Durr said, again, it's your own platelet-rich plasma. It's your own PRP. So the body is going to do well with it because it's not a foreign body introduced to the penis. It's your own cells. It's your own plasma. So by doing that, the body responds really well.
Yeah. And the couple questions, again, we've already addressed, but just to bullet point them, I always like bullet points. It's no downtime outside of the numbness that you will feel right after the procedure.
And be thankful for.
And that will wear off. And then there's no downtime. And again, there are no reported adverse effects with PRP, except anytime we put a needle into anything, we could potentially cause bruising or swelling. It's still very rare. We don't frequently change anything that you're on to perform these procedures. It's a 1 hour procedure, in the office, even if typically we're doing that with Gainswave, which is a frequent combined modality based on pretty much what you're coming into us for, then essentially it's still a 1 hour procedure. And anything else that you can think of, pain is the big thing. No pain.
And no pain, no downtime.
Yeah. And an office procedure. And so you just need to find an office that you trust to seek out these procedures. The only other question that I see frequently proposed, and I think this is more of a, on the internet forum, people exchanging information back and forth, is they will say that it increases length and, or increases size, I should say 20%. And in actuality, there's probably nothing that increases length. And there's a potential that you could have some increased girth. And again, you can get that with pumping as well, which is very effective. And if you're not going to have active erections and sex during P-shots, in that regeneration process of the 2 or 3 months that we usually have you pump during it. So there's a potential that you could get increased girth with that. And even with one of the pumps, maybe there's an argument that you might get a little increased length, but really nothing solid about
Significant.
length. But I would always say that that's not why we're doing it. So if it's strictly just that you want increased size, it wouldn't be something that I would promise. That's not the expectation that we set up. But I'm just thinking that when you get full erections back, then you get that increase in size back as well. So any other thoughts on the size issue? Have you heard anyone specifically commenting on?
I've had people ask if it increases length and girth. And I'm like, well, are you here for that? Or are you here for performance and erections? Those are two very different conversations, because if we're not here to try to improve sensitivity or performance and you're looking for length and girth, there's probably a different conversation that needs to happen. Yes, the B-shots can be beneficial and optimize, of course. But again, if you come in with that expectation, we're on two different pages. We just need to
be on the same page.
Be on the same page and have a
That's
talk
right.
about it. Because there's other things you can do to get a little bit more girth.
Yes,
There are other procedures
but
for that.
that is definitely a different conversation.
Exactly.
I agree. Well, perfect. Well, I think we covered just about everything. And again, if there's something that you have a question about that we haven't covered, then leave it in the comments and subscribe, hit the bell, share. And again, let us know anything that you want to hear more about. And thank you, Faraday, for being with me today
Thank you
to
for having
talk
me.
about the P-shot. And again, we're here to revitalize your look, your health, and your sex life. So let us know what you want to hear more about so we can bring it to you. Thank you.